live, correct? You are? Okay. Are you live now?
We're all streaming.
Okay, perfect. Okay. So I'm ready to go ahead and get started. Sergeant Jake Becchina with Kansas City, Missouri Police Department, Becchina, Jake. Again, Sergeant with the media unit with Kansas City Police Department. Start right now with question availability in regard to our most recent updated statement for members testing positive for COVID-19. So I'll just take whatever questions you guys have at this point.
Sergeant, you've reported that 2 officers have tested positive for COVID-19. Can you share if any or both of those officers had direct contact with the public? Were they patrol officers?
So just a little bit of specificity on that. It's one sworn member, one non-sworn member. So we have a police officer assigned to the Patrol Bureau, one of our patrol stations, and then a non-sworn member that's assigned to administrative tasks within the department.
A civilian employee?
Correct, yeah, non-sworn civilian employee. In addition to that, based on CDC recommendations, health department recommendations, those that have had close contact with those members are taking proactive measures as far as quarantine. And we have 16 members total that are in that protocol right now as of this morning.
Jake, when you say members, can you break that down between sworn members and civilians?
Of the 16?
Yeah.
I don't have those specifics, yeah.
But they're
yeah.
not all sworn?
I don't know that, yeah. Of the positive confirmed, 1 sworn, 1 non-sworn, yeah.
And the people who tested positive, are these related to the travel quarantine that you talked about yesterday?
I don't know. It's obviously too early to tell, what the possible exposure was with regard to those. Yeah, sorry.
Sergeant, in New York City, 10% to 15% of its police force is out sick because of COVID-19 on a daily basis. Can you describe the plans for dealing with a similar situation here?
Yeah, so we've looked at some of the eventualities, some of the possibilities. We have plans in place as far as our operations and our procedures based on where we fall as far as members in quarantine testing positive, following the CDC guidelines. Obviously, the 14-day quarantine that comes into place, that could affect some staffing numbers. We have provisions in place that we have already pre-discussed that will allow us to continue police service, to continue responding to calls for service, to continue to be out there in the community, even with some members that are on either precautionary protocol or with a positive test.
And would patrol be the priority? You would shift resources into patrol?
Absolutely, yeah. Our main priority is being able to respond to 911 calls for service. When people call, we need to be able to respond, we need to be able to get there, and we need to be able to help them. And we've got provisions in place to keep that going through any imposed quarantines, any positive tests, or anything like that.
And can you talk about what's meant by Tier 1 or Tier 2 staffing, canceling time off, shifting traffic officers into patrol, that sort of thing?
Yeah, so any of those things would be potential provisions that could be put into place to ensure that we have staffing in place to respond to calls for service. That would be some of those things that could be discussed.
And can you say if any of those things are in place right now?
As of this morning, right now, we have all the provisions in place to still respond to calls for service as people call. That's what we'll continue to do. So that's basically where we are right now, is ensuring that we have response to calls for service.
With 6-foot distancing, are you still putting 2 men or 2 officers in a car, or have you spread that out?
I don't know the answer to that question specifically. As of right now, I know this morning officers were still deploying in a normal patrol capacity, but as far as if they will be shifted out of cars or split up in that capacity, we'll still respond with 2 officers to a call, even if it's a 2-officer call, whether or not they're in the same car. And as far as that operation right now, I don't believe there's been any change to that.
And just so I'm clear, Sergeant, Tier 1 or Tier 2 has been implemented in some form?
We're implementing right now provisions to ensure that calls for service are handled. As far as any how it's ranked or numbered or anything like that, calls for service will be handled prioritized, and we'll have our staffing in a place that ensures that is handled.
And Sergeant, I've read that former Governor Greitens brought some personal protective equipment to the police department. Has it been distributed to officers on the street?
Yeah, we received 500 masks yesterday as a donation provided to us. We've received masks. We've received outpouring of support. We've received a lot of things from a lot of members of the public. What we're doing is taking all those in. We're distributing those through our patrol bureau to get them out to officers that are out on the street so that they can be in their hands to help them just as soon as possible and as effectively as possible.
Calls for service up, down, the same?
We've looked at it twice over the last 2 weeks. The first time we looked at it, we compared a 1 week period this year versus last year. We saw a reduction of about 4%. We did it again last week, saw a reduction of about 6%, looking at a 1 week time span. I'd say they're down a little bit. These are high priority calls, that is. I'd say they're down a little bit, but it's small percentage numbers.
So, can you respond? The Fraternal Order of Police says that officers have to purchase out of their own pocket basic items like sanitizer, which they feel like it should be provided by the department. Can the department do more to provide basic safety cleaning equipment?
I think I've lost track into the hundreds or thousands of gallons of sanitizer that members of the public have donated to us. We've had some really innovative things. One of our local distilleries shifted operations over the last week and a half, started producing hand sanitizer. I know we got hundreds of gallons and bottles from them. We have hand sanitizer, we have cleaning products that have been distributed to every police station, to every patrol operation, down into the hands of patrol officers. I'm not sure what FOP had said. I didn't hear what their comments were, but I know that we've got hundreds or thousands of gallons of sanitizing materials that are here in our buildings, that are out with our patrol officers, that are out with our officers as they're doing their operations.
So just so I'm clear, would the FOP be wrong if they're saying officers are having to buy stuff out of their own pocket?
I'm not going to say that no officer went to the store and bought hand sanitizer if they found it. I mean, I keep hand sanitizer in my car. I always have.
But they shouldn't have to, is what you're saying.
The department's providing cleaning materials and sanitizing materials to all of our operations, to all of our locations.
Did either of the two officers have any contact, two members have any contact with anyone?
It's hard to say, obviously, because we're going about police operations. We're continuing essential functions. What we assume is, what we tell people is to conduct safe operations. One of the things we've been doing for the last 2 weeks, this 6-foot distance has been something we're focusing on. We've been doing things like asking people to come out of their homes if we go on a call for service and keeping a distance like we have here right now today in order to ensure the safety of both the public and our officers. Those are things we've been focusing on for a couple weeks. By the nature of police business, we're going to be out in public. We're going to have contact with people. So that is inevitable. That's something that we're going to have as we are doing our business out there. So as far as what these individual members had as far as contact, what I do know is the health department is following their guidelines and the CDC guidelines as far as following up with anybody that may have had contact with a confirmed positive individual, just like they're doing with every segment of the population.
Sergeant, I know there are so-called reserve officers. Would there be plans to ask them to come up, so to speak, or be pressed into service?
Yeah, reserve officers, we maintain constant contact with them. They essentially volunteer their service. They're required, and they do that with the expectation that they could be available for an assignment at some point in time given the needs of the community. So we're in constant contact with them should they be needed on a call-in basis or something like that. They're maintained at Human Resources. We have all of their contact information, and they get the same communications that active members do as far as preparations, protocols, all of those things.
Can you say what the numbers are of reserve officers?
I don't have the exact number on that. Yeah, I'm sorry.
Have you pressed them into service?
I don't believe so. Not as of right now. Nothing. There's been no compelling or anything like that of service from them. Again, like I said, we're handling our operations. Our staffing is good right now. We've got protocols in place, and so it's not a matter of like calling in any additional people or shifting things away from essential functions or anything like that. 911 calls are getting answered. Police officers are driving around in the city, and we're doing well on staffing right now.
With 16 in quarantine, I mean, is it fair to say that on a normal day you might have 16 people calling sick anyway?
That's probably. I mean, we on any given day, a number of people would be out sick or out on training or out on vacation. I don't know what the percentages would be on an expected basis. it is absolutely reasonable to think that there could be any number of people gone on vacation, gone on training, gone on sick days on any given day of the year.
With the ban on large gatherings, how is police thought about enforcing that?
Yeah, no, that's not been something that we have proactively enforced. Chief said last week, and we've said continually, we're not looking to enact some kind of a police state where we have roadblocks set up or anything like that, where we are just going around looking for people that may not be conforming with the ban on public gatherings or the ban on non-essential businesses. What we're doing is we're responding to calls for service. We're handling business as crime matters come up, and we are contacting people in those contexts. So it's not something that we're proactively out there looking to count people or find 11 people. We're in the business of keeping people safe, and the safe thing to do right now is to limit social distance and to follow the guidelines of our city, our state, and our federal government as far as the things that we can do to keep us all safe. So we're not looking to do any overarching enforcement of anything like that. We're not looking to be to put ourselves in a situation where we would be needlessly adding to that problem. So we want people to take responsibility on their own, to follow the guidelines, and to follow the procedures that are suggested to them by local, state, and federal governments. We're out to keep everybody safe. If there's crime, if there's something going on, if there's a disturbance, we're here to help. We're trying to keep ourselves as healthy as possible so that we can continue to do that, and we hope the public continues to do that for themselves and for us as well.
Mr. Mayor, since you're here, would you like to share a thought about whether you're concerned about increased police absences?
Well, we know that at our press conference.
Yeah, we got it for you. So change it. Okay. Although we're all gathered right now, it would be helpful.
We'll do that later.
On to other happenings.
Are we ready to shift?
Yeah, I'm ready if you guys are.
Any update on the?
Yes, update on the child shot last night. I'm sorry.
Yeah, so it was a female. Last night I did not know the gender. So it was a female, the age of 10, so younger child. She was shot, taken to the hospital, initially reported to be in critical condition. That's been updated as of this morning to stable condition, so that's good news.
And I know there have been reports in other places that violent crime has subsided in the wake of this public health emergency. What's it like? What's happening here?
Anecdotally, I don't see that here. We've looked at some of the numbers. While calls for service are slightly down, we've looked at things like non-fatal shootings. We analyze those on a regular basis. For the month of March, non-fatal shootings are still up as compared to same time last year. For the year to date, homicides are still up by 2 from the same time last year. So these things are staying about the same or maybe slightly up. There is no major downtrend in any type of violent crime that we look at on a regular basis.
And investigating violent crime during the era of social distancing pose additional challenges for detectives?
Sure. I mean, there's all of the things that you would think of when we would normally do business in close contact with somebody in an interview room or things like that. We have to kind of get creative. Again, outside and distance is our friend in these situations, and so applying that logic to a criminal investigation, the detectives are being creative in those same manners as well.
What about the idea that fewer people on the streets might also mean fewer witnesses?
That's possible, but there's more people at home in their homes. We know that, again, as an example, yesterday, homicide scene, as I stood around out there, it was quiet. There was very few cars passing by. There was very few people that you heard the normal noise of the city. It was very quiet. I think that could also be a good thing. If there's many people at home in their house, they're more apt to hear a disturbance. They're more apt to hear gunshots. They're more apt to hear something that precedes something unfortunate like somebody getting shot that happened yesterday. So it's a better opportunity, I think, for people to be on the lookout to have a hand in helping things go right. If they're hearing things outside they normally have heard because cars are passing by, say an argument or a disturbance, that's an opportunity for them to call 911 to get police there before something bad happens. If they're hearing signs of a disturbance or gunshots, maybe they wouldn't have heard that before because maybe they wouldn't have been home. Again, that's an opportunity to act as a witness, to call the TIPS hotline anonymously, to get that $25,000 reward and to bring justice to somebody's family that's suffering loss of a loved one or serious injury of a loved one. Okay. Is that it? All right. Did anybody need the 5-year-old shot last night? I'm 99% sure all of your desks asked about it or had it.
I don't know. Can you run me through real quick?
I could just send you a statement.
Send it to the station.
Okay, yeah. In fact, hold on. I'm about 99%.